Hi everyone, my name is Mimi Omareji. I am the Director of Recruitment, Retention and Outreach for the UCSF School of Nursing. Very excited to be here. And with me today is our guest faculty member, Dr. Pelter, and some students, as well as our PhD student advisor. And they are all going to introduce themselves. So I'm going to hand it over first to Dr. Pelter. Dr. Pelter?
Thank you, Mimi. Welcome, everyone. It's exciting to see everybody. I see 24 participants, which is awesome. So I am Michelle Pelter, and I'm an associate professor in the Department of Physiological Nursing. And my area of research is focused on hospital-based electrocardiographic and physiologic monitoring, just to give you a little bit of a highlight of my program of research. And maybe I will pass it along to one of our student guests, Julianne.
Hi, everybody. My name is Julianne Ballard, and I'm going into my third year of the PhD program. For my over 3-decade nursing career, I've mostly focused in public health across the lifespan. And my interest in research is understanding how parents experience conversations about adverse childhood experiences with home visitors. And I'll pass it over to Kelly.
Hi everyone, I just finished my first year in the PhD program, so going to be entering my second year in this fall. And my research interest is on burnout among nurses. My clinical nursing background is in pediatric hematology, oncology, and bone marrow transplant, and just seeing how burnout affected nurses in my specialty, but also in a whole bunch of other specialties during the pandemic and post-pandemic. So excited to do research in that area.
Hello, everybody. My name is Debbie Akoba, and I am the Nursing PhD Program Manager, and it's nice to see everyone this evening. Hopefully, we can answer many of your questions as you prepare to submit or finalize your applications.
Thank you, Debbie, and thank you to our students for being present with us this evening. We also have another special guest. I'm going to give her the opportunity to introduce herself. Dr. Lynch, do you want to go ahead?
Sure. My name is Mary Lynch. I'm the Associate Dean for all the education programs, which means that I am also involved and excited about those of you who are considering the PhD program. My research interest is on ethical issues for children who are hospitalized for long intervals. And I can turn it over to Wade.
Thank you, Dr. Lynch. I'm Wade Bennett. I'm the marketing specialist for the School of Nursing, and it's nice to see everybody tonight. Thank you.
Thank you, Dr. Lynch, and thank you, Wade, for being here with us this evening. This evening, we're going to go straight into our presentation, and it's going to be about 20 to 30 minutes presentation, and then after that, we will go into question and answer segment. So if you do have questions, please write them down as we go. And with that, I'm going to hand it over to Dr. Pelter to begin the presentation.
So again, I introduced myself and my program of research. And on that slide, you saw some examples of some prior students and their work, which can be helpful for you to kind of ponder on what students have done in the past. So we are here. Go ahead, Mimi, to the next slide. I apologize. We are here to talk about our PhD program, but we wanted to distinguish DNP from PhD. And I'm going to ask Dr. Lynch to weigh in on anything that would be pertinent to DNP because of her expertise in this area. But it's kind of important to think about these two roles. And we have here two columns. On the right side of your slide is the PhD. So that's really what we're focusing on here tonight. But the focus of these two degrees is the Doctor of Nursing practice, the DNP, is just that. It's a focus on practice. And really, in my mind, is translation of research and evidence-based practice into practice, however that looks to you if you're a nurse practitioner, an administrator, etc. Whereas a PhD is what I call generators of research, so that PhD nurse scientists sort of generate research that then gets translated into practice. The programs, we have program length, they are rather different. We have both a postmaster's, so you might come into a DNP program at UCSF having a master's degree. You can see it's 7 quarters. We just started this summer a post-baccalaureate to DNP, which is 12 quarters, and those are all in a row. You don't get a summer, in other words. The PhD is 3 to 4 years. And again, it really is simultaneous, although the coursework is really concentrated in what we consider sort of a traditional school year, but you will be doing activities over the summer time. Teaching experience is not necessarily required for a DNP. And while it is highly recommended in the PhD program, that can take many forms. You could be an educator, have taught within a hospital or a public health setting. Those would all sort of apply to that particular criteria. Here's where I think these two are quite different, in my opinion, is the final assignment, so that the DNP is going to be a project. Again, it is just sort of this translational piece into practice, whereas a PhD will be a dissertation, so that the student formulates a question, a research question, and does a study around that particular question. So they're quite different in that sense, and sort of, again, I think of it in my mind as sort of a translational person, a DNP, versus a generator of new knowledge in the dissertation process. So the format, the last part of this here, is that our DNP program is remote learning with 3 in-person immersion sessions. Again, Dr. Lynch can probably speak more in detail about this, but again, our focus tonight is the PhD, which is more in person in terms of the core courses, and we do have synchronous online format for some non-core courses, but you would probably find the PhD program to be more of a in-person experience. And I don't know if Dr. Lynch wants to weigh in on any of that or move on to the next slide. I think you're muted.
Sorry, this has been a long day, and if you can flip back to the prior slide, that would be super. When we're looking at programs, I totally agree with the PhD that you're generating new information. So given that I'm pediatrics, I'm going to use that as an example. Let's say that you're in the PhD program and you really want to look at, do certain analgesics work better in relieving pain in children who are getting different therapeutic interventions. So you might be looking at examining different analgesic strategies or adjunctive strategies for children who are receiving certain pharmacologic interventions. So you're actually testing a specific population, or you might be looking at secondary data and examining specific outcomes. But let's say in your research, you identified that there are certain analgesic strategies, when they're coupled together, work better as far as relieving acute pain in children getting therapeutic interventions. I might do that as a PhD student. However, as a DMP student, what I'm going to do is I'm going to take your publications and other publications that have been written about specific pain management strategies with specific therapeutic interventions. And I might set a quality improvement intervention where I'm going to lay out a new policy that we are going to examine as far as having specific therapeutic interventions aligned with analgesics to see if there are differences in pain management overall. So one is generating that new data or new outcomes, whereas the DMP is taking a series of outcomes on a specific topic and then using those outcomes to implement a change in practice and to look at differences in a specific outcome, such as pain management over time. The difference between postmasters and post-BSN, just real fast, our postmaster students literally are doing a 7-quarter progression. So that's approximately a little over a year and a half to actually go through the coursework and to also do the scholarly project. Our post-BSN, these are students who do all of that postmaster's work, but they're also getting a specialty. So if I wanted to become an FNP with a DNP, I would go into the post-BSN program. So there is a specialty focus in addition to the DNP, whereas with the PhD, your primary work is to really take in a substantial amount of new knowledge and expansion of knowledge to actually do a real-time research investigation. So the post-BSN, the longer one, actually does involve a substantial more time on campus because you're doing the clinical application. And take it away, Michelle.
That's great. I would like to mention that applicants can come into our PhD program with a BSN. You're not required to have a master. So I just point that out. Thank you, Mimi. Go ahead. So just sort of post PhD, here are just some opportunities that would come your way. Academic faculty, which is myself. There are nurse scientists within health systems, hospitals, research scientists in both private and public sector, corporate nurse scientists. These are just some different outcomes or opportunities that could come your way after achieving a PhD. Chief nursing officer, again, sometimes DMP, PhD, it just kind of depends on what your goals are. Go ahead, Mimi. So these are just some samples of dissertation titles in the last few years, and I'm going to hand it off to Julianne and Kelly to talk about their work as well as you read these sort of topics that we have here.
Thank you. So yeah, as you can see, there are a variety of research approaches that students have taken in the past, some qualitative, some quantitative, and then there are students that opt for a mixed method approach and synthesizing both quantitative and qualitative research findings. My research dissertation proposal is at the top. I just actually passed my proposal meeting, so I'm thrilled to be starting on my research. And just to say briefly that I did not come into UCSF thinking that I would do qualitative research. I really had hoped to do quantitative research on this particular phenomenon, but It actually ended up being necessary to conceptualize this phenomenon a little better by starting with qualitative. And I'm learning quite a bit, so it's been very rewarding. And I think that's it for me.
Yeah, and again, my research interest is on burnout among nurses, and I looked at qualitative articles related to that topic and quantitative articles, and I think just kind of the quantitative track is just more like kind of like aligned with my kind of how I look at problems and things like that. But I do always love reading the qualitative articles in burnout on nurses, and I think if you're still kind of wondering maybe what you'd want to research in the PhD program, kind of looking maybe in like where you're working clinically and seeing what kind of questions pique your interest. And that's kind of how I came across burnout among nurses, was just kind of noticing how my coworkers were being affected. And originally, I kind of always thought I would go and get my PhD and do research and teach. But at one point, I was more thinking of doing a more like my focus being more on pediatric oncology patients and looking at like pet therapy, animal-assisted therapy, and psychosocial interventions for pediatric oncology patients, but then seeing just how the pandemic affected nurses on my unit and throughout the whole hospital and healthcare system, that just really was more, I could see that that was just more aligned with my passions. So kind of seeing what questions come up in your head during your workday clinically can kind of pique some of these interests.
Thank you. So this is a synopsis, if you will, of the curriculum. It's probably a little more in depth than this. It's full-time core courses for the first year. Just to give you a sense of, I pulled up sort of the courses. So you will take a qualitative research design, quantitative research design. I know we're throwing out a lot of terms here. Philosophy, and then you will do an introduction to biostatistics. Last year, these courses were concentrated on Wednesdays and Thursdays. Whether that will happen after you apply to the program, which we hope that you will do, we shall see. It kind of, the days of the week can change. That was sort of the fall quarter. The winter quarter builds on that. You do some theory. You take a course in writing in integrated scientific literature review. You do advanced quantitative and, again, a statistical course. That particular group of courses, again, in the winter, were concentrated on Tuesday and Wednesdays. That's, again, sort of traditional classroom types of things. And then in the spring, you take a theory course, an ethics course, and quantitative research methods. And those were concentrated on Thursday. Again, I don't want to lock into those days, but that's sort of how that first year looked. It's what I would say is sort of a traditional looking educational experience where you are taking didactic courses, but you are definitely writing in these courses. So it's coming in with a research question and really sort of trying to build on that particular topic in these courses, because most of them your deliverable is a written paper. And so, but you take it in the context of those core courses. You can look at year two. It's similar in terms of coursework. We have you take some what we call cognates. These are sort of specialized. You get to kind of pick and choose, if you will, courses that are sort of important to the work that you're going to be doing. You will, in year three, sort of culminate all of this with what we call a qualifying exam. It's a both written aspect as well as a verbal or oral examination that you do. We have a year four here, just in that some students do their dissertation research in that year 4, but it can get moved up as well, where you finish your qualifying exam at the end of year 2, and year 3 is devoted to the dissertation. Again, this is an original research question that you work towards, and your deliverable is a dissertation. Go ahead and go forward there, Mimi. All right, so the next part of this is sort of the application phase, and the expert, I think, on our Zoom call is Debbie. So we're going to turn it over to Debbie to kind of talk about the components of the application.
Thank you, Dr. Pelter. So you're all here for a reason, and I hope, you've all been able to maybe take a peek at our website and just know that the application is open. It opened in the middle of July, and that the deadline is December 1st, 2024. Up on top is the link to where you will find all of the content in the next few slides. So I just wanted to go through each one of them so that, maybe you can have a visual to go along with, the knowledge of what's required for the application. So I'll go ahead and start. The key application components will be, either a prior degree in nursing, a BSN, as Dr. Pelter mentioned, would be a requirement for the PhD program. If you do have an MSN, that would add to your application as well. And if you can see here, the minimum GPA for the BSN would be a 3.2 on a 4.0 US scale. And for the master's, it would be a 3.5 on a 4.0 scale. RN licensure. It is required that applicants are licensed in the state of California or in your home state of residency or country. International students, it is required that you are licensed in your country. It's not necessary that you become licensed in California unless you plan on doing clinical work during your program. The course prerequisites, we require a statistics course, which is a college level within 3 years of entry. So basically a course that was taken, the fall of 2022. Anything prior to that would not, that would be out of the recency requirement. So that's within 3 years of entry. The research course, which would be a research and method and design, would be a course that is taken within 5 years of entry. Next slide, Mimi, please. Transcripts. We need to see transcripts from all relevant institutions, including your course prerequisites. Unofficial transcripts will be accepted at the time of application submission for review purposes, though official transcripts will be required if admitted and are due to our office prior to enrollment in the fall. All non-English transcripts must be translated by a certified translator for evaluation. Non-US transcripts must be submitted for evaluation. The graduate division lists, I believe there are 4 approved evaluation services, which the applicants may utilize for getting an evaluation. Recommendations. Our program requires 4 recommendations, and we strongly advise that applicants do secure recommenders well ahead, and that those recommendations are submitted by the application deadline. If a recommender that an applicant puts down is not available, you should identify another and secure them as soon as possible, because you might reach out to someone and they may say, sure, I will submit a recommendation on your behalf, and then something comes up and they can't do it. It's really important to get those recommendations well ahead of time. At least 2 recommendations should come from the most recent employer, preferably nurses. 1 to 2 from individuals that are not relatives who are well acquainted with your professional preparation and experience. And for any of those who are currently enrolled or were enrolled as UCSF students, or there is a separate section for who your letters of recommendation may come from. Next one is the resume or CV. Next slide, Mimi, please. Goal statement. We would like to see a maximum of 5 double-spaced typewritten pages. And we would like to see applicants identify area of research interest, include related clinical, teaching, and/or research experience, show congruence of goals with the School of Nursing PhD program's goals and UCSF. Address fit between your research interests and the research of nursing PhD faculty members. Address future goals and contributions to be made to nursing science after completing your PhD. For the personal statement, we'd like to see a maximum of 3 double-spaced typewritten pages. Discuss how your personal background informed your decision to pursue a PhD degree. Include any of the following: educational, cultural, economic, family, or social experiences, challenges, or opportunities that are relevant to your academic journey. If applicable, you may discuss your experience working with people from diverse backgrounds. Next slide, please. Faculty connection. We have a faculty profile lookup, and that is the link above. And there is a way that you can enter in your interests that will help hone in a list of faculty at UCSF who may be affiliated with our program. So you would go to the link. There is an advanced search tab. You can go to the topic and research interest field. In the topic field, you would enter in your research interest. Under the school, you would enter in the School of Nursing, and you'll also click researcher. You'll tick the professor, associate professor, and assistant professor, and then hit the search button. This system will generate a list, and you are more than welcome to reach out to me and inquire whether or not those particular faculty members are associated with our program. The list of nursing PhD faculty will eventually be listed on our website, and we hope that'll happen fairly soon. And I'm going to go ahead and turn this part over to Dr. Pelter so she can talk a little bit more about the School of Nursing research themes.
Very good. Thank you, Debbie. I think this component of your application is really important, is to identify an advisor that is going to really support you and help you through the program. A couple of years ago, our PhD faculty got together and designed 5 research foci. And Mimi is showing you this website here. So we have health equity, community and population health, aging and life course, digital health, omics and data science, and symptom science. So again, this will be a really important link. And maybe, Mimi, I will have you click on the health equity. You know, again, these are sort of broad topics. If you click on this and you scroll down, what you will find are some projects and faculty members who are working in that space. And so this is where you might reach out to Dr. Asiato, who is working on motivating interdisciplinary lactation knowledge, okay? So that's a really cool acronym, by the way, MILK. I love it. So this is another way that you can find faculty that could help you, you know, with your research topic. If faculty here cannot help you, they will direct you to somebody who can. So I happen to be more in the data science piece, and my colleagues will know enough about my work that they will say, you know, thank you for applying and your interest, but I'd like to, you know, based on your in-hospital work, speak to my colleague. So again, you will probably want to interview, you know, a few faculty members to see who is a good fit for you. This is a really important part. You need to be sort of selfish here and think about, you know, who is going to take me through this program and who can guide me and advise me in these areas. Sometimes it's not a perfect fit, but you know, you can find, you know, some common ground here of faculty that can really help you through this process. This is a really important part of your application, is to really identify and talk to several faculty members who are able to, you know, advise you and mentor you through the program. I think you can go forward, Mimi. I can't remember what we have next. And I think I'll turn it back over to Debbie.
Thanks, Dr. Pelter. So as we continue, the English proficiency requirement for those whose native language is not English, we do require the TOEFL or the IELTS. So the minimum score for the TOEFL is a 92 with a minimum of 24 in both speaking and writing. The IELTS minimum score is a 7. And when indicating which school you would like your course sent to, please use institutional code 4840 and department code 43. Exam waivers may be considered if you are an applicant who completed 1 year of study with a minimum GPA of 3.0, which is a B average, on a 4.0 US scale at an accredited college or university in the United States, or if your relevant degree was earned from a university outside of the US and instruction was delivered fully in English. There is an application fee, which is $120 for US citizens and permanent residents, or $140 for international applicants. US citizens and permanent residents who demonstrate financial need, who have significant difficulty in paying application fees, may be eligible for a fee waiver. If you are an international applicant and feel that you may also need some sort of a waiver, that will be considered on a case-by-case basis. So if you reach out to me, I can discuss with our program director and we can see what we can do for you. Next slide, Mimi, please. Funding sources for the PhD program. We have a 3-year funding model. It supports California residents' tuition and fees and a stipend. Please note that for non-resident tuition, it does not extend beyond the first year. So if you are a US citizen or permanent resident, if you are not from the state of California, you are required to reclassify to California residency within 1 year. International students, however, are not eligible to reclass, so will be subject to the non-resident tuition beginning in year 2. I just wanted to, mention once an international student has advanced to candidacy, so once they've completed their qualifying exam and are getting ready to write their dissertation there in candidacy, that non-resident tuition will go away for 3 years. So that is, a nice break, a financial, to sort of ease the financial burden a little bit more. We also urge residents and non-international students to apply for federal loans and to submit a FAFSA once admitted. The University of California Office of the President compiles comprehensive private student loans lists that contain loan terms and interest rates, as well as lender contact information. If you'd like to see those, please go to the following link. Our school, our student funding office does have a list of funding opportunities available to our students at the link down below. So if you're curious, you can go ahead and plug that link in and have a look. I wanted to provide all of you just an idea of what estimated cost for the program is per year. Now, mind you that this is for a 9-month period. It is rather conservative, so it doesn't include everything. If you want to see a breakdown of these list items, which includes tuition fees, living expenses, transportation, California resident total is about $54,636, and if you are a non-resident, the total is $69,738, and that's annual. That's within a 9-month period. You can maybe break that up minus the tuition and fees, and add on 3 more months. This is just to give you an idea. Next slide, please. And I wanted to just point out that there are quite a few resources at UCSF. Our housing office does have listings for apartments and living, lodging over at 4 different sites at UCSF. So, we have, many postdocs, students, graduate students who are residents of those venues. Next slide. I also wanted to mention that we have a Student Success Center here at UCSF, and they offer many, many support services to our students. We've got connections to basic needs, health, if you are in need, disability services. Like I said, there's housing. It's a little bit small here. I'm really sorry that it's a little bit tiny, but if you have a chance, please Google that link or navigate to that link, and you can see a full list of the support services that are available to our students. Definitely, we would like to set up our students for success, and we partner with all of the offices around campus that do support our students. So there is a mechanism at UCSF to make sure that our students are successful. And I just wanted to reiterate, if you haven't started your application, the deadline is December 1st, and we really, really hope that you will consider UCSF for your doctoral studies. As you saw in the previous slides, there are many pathways and many career options for you with your PhD. And there are a lot of alumni who had many, many successes since leaving UCSF. So shall we open it up to questions?
I think so. I feel like we've been doing a lot of talking, so it's time to hear from you all that attended tonight. Mary, Dr. Lynch, did you want to say something before we start our question and answer segment?
The important piece for you to know is you've heard a lot of information and you can't always take it in. Please reach out to any of us that are here. And if you forget everybody's name, but remember Mimi's name, that would be super because she can get to the rest of us. But it's real important to sort of take this in, think about it. It's easy to say, oh, I'm not smart enough, I'm not good enough, I don't know if I have enough knowledge. You know what? That is not the case. And you really are more ready than you actually realize. So please let us help you if you can ask us questions.
Hi, my name is Simran. I had a few questions. My first one was, I was wondering, so I know we have to take a research methods course and a stats course. I'm enrolled in a statistics course right now, um, to fulfill that requirement, but on the website I saw that I just need to take the research methods course before like enrollment. I'm wondering, so does that mean before starting or like before sending an application?
So I'll go ahead and answer that question. Thank you very much. Your course prerequisites may be what we call in progress at the time of application submission. If you are admitted, you would be required to have those courses completed with at least a B grade or higher and a corresponding transcript submitted to the school prior to matriculation in the fall.
Okay, I see in the chat that Kimberly had the same question, so that's good. We have another question in the chat from Leslie. To clarify, after a year of the program, we are able to apply for in-state tuition. Is that correct, Debbie?
Yes, so as a non-California resident, you would need to establish California residency upon, so once you move to California, you would need to save your rental agreement, register to vote, do many things to establish California residency. And I believe prior to the start of the new year, you would send in an application to the registrar, apply for California residency, and then they would reclassify you. If, however, you are not able to do that, then you would be subject to the non-resident tuition in year 2, or until you are able to reclass to California residency.
And you have to live in the state of California for 365 days and show the proof that Debbie mentioned before you would be eligible for consideration as a California resident.
Thank you, Dr. Lynch, and thank you, Debbie. We have another question. This might be a good question for some of our students here. Isaiah is asking, considering that a PhD is heavily research focused, to what extent is research experience considered in the application process? The other part to the question is asking, and to add to that, how can someone with limited formal research experience be a more competitive applicant? Julia, did you want to say something?
Take a first stab? Sure.
Go
So
ahead.
I was not a researcher prior to coming here. I was an active public health nurse for many years. And I think by highlighting some of the projects that I had done on the job that were quality improvement issues or areas where there was actually some analysis or evaluation. That was really helpful. I did have in my master's degree a thesis that was research focused, so that was also very helpful.
I will chime in here too, having looked at applications. I don't think being involved in formal research is completely necessary, but engagement in kind of a inquiry approach where, I work in this setting, and one of the things that really occurs to me is this, and I've always wondered that. So it can be even your inquisitive mind about wanting to solve a problem in clinical practice that you can really speak to in that personal statement that you get to. It's not the person, it's a goal statement that you get to really say, I really wish that we could solve this particular problem. So do not let, I haven't done a research project or written a paper, don't let that stop you from applying to the program. Your passion for a topic and solving it within the context of nursing research will really go a long way. So, you don't have to have formal, you can, but it's not necessarily a necessity. I hope that makes sense.
I was just going to add to that if you are reaching out to faculty to see if they might be a good match to be a potential advisor, or just kind of looking more into that research interest from the list of faculty on the website, different opportunities might come up just from meeting with those faculty. Like when I met with my advisor and I was talking to one of the clinical nurse researchers at UCSF, they both were working on this burnout study for ICU nurses, and then they kind of added me into that program. So I got to have some more research experience, and that just came about just from reaching out to them and talking with them and learning about that opportunity. So you also might not know what research opportunities come up just from asking to talk to different faculty that you're interested in.
Thank you so much, Kelly. That was really good. And thank you, Julianne and Dr. Poulter. Another question in the chat. I want to be mindful of the time. We have a question from Nana. I understand a few programs have a DNP to PhD bridge. Does UCSF have a process like this? Dr. Lynch?
Not yet, because we just really started our post-baccalaureate DNP. It is something, though, that we are considering for the future, but it's not going to be this coming academic year.
Thank you, Dr. Lynch. Kimberly said, I attended a PhD info session January, February 2000. There was a mention of an internship either in year 2 or 3. Is this still the case? Debbie?
So I can take this on, Debbie. I'd love for you to offer some suggestions too. We don't have a formal internship program. What I would encourage, or what it's more of an opportunity that would come your way, is if your advisor or other faculty have research grants in place, that you absolutely have the ability. In fact, you have credits in research that you will need to complete. And this is your opportunity to engage with a faculty member that has a grant, research project, et cetera, to really sort of engage with them in that, whether it's data collection, analysis, manuscripts. I think, Julianne, I don't know, Kelly, you've probably had experiences like that, where, something comes up and you have the opportunity. It's sort of an internship, if you will, but it isn't called that. It's really just engagement with other faculty and research projects?
Yeah, so the residency, you can divide into units that allow you to either focus on one project, or like I did, I actually divided my residency so that I could do both a qualitative and quantitative experience, and with two different researchers. And I found that really valuable.
Yeah, we typically have our students perform about six units of a research residency. And like as Julianne said, you can either split those up between two faculty or, one on a specific project. But, a formalized internship, we don't have that per se.
Okay. We have another question. We have a few questions. We're going to try and get through some of them, but we want to be mindful of our guest time today. So we're just going to take two more. And if you have any other additional questions, you have my email and Debbie's. This question says, please, I need more clarification on the research methods and statistic course prerequisite. Would you consider an online course, or it must be a formal school course, considering that I completed my master's degree in 2021?
It would at least have to be by a course taken at an accredited institution. That's, and one that would be able to issue an official transcript with a grade. So, for instance, if you wanted to take a statistics course at Community College of San Francisco, you could do that. They are an accredited institution. If you are in doubt, if you have a question about an institution where you would like to take a course, you're more than welcome to reach out to me by email. Send me the course title, a link to the course description, and then I can confirm whether or not the institution is accredited and whether or not that course would meet the requirement.
Thank you, Debbie. One more question before we say goodnight. In the presentation, it was stated that the length of the study for the PhD can be between 3 to 4 years. What's the percentage of students finishing the program in 3 to 4 years? And how many students does the school typically accept per year?
I can speak to that. I would say that over the last few years, we have brought in a cohort anywhere from 8 to 12 students. And within those cohorts, I would say at least maybe 1 to 2/3 may finish in 3 years, but typically it might, it will go beyond that 3-year mark. It can be done in 3 years if you are focused, if your research focus, if everything is mapped out for your program, it can be done. Dr. Pelter might want to say a few words about that. But yeah, every year it's been about 8 to 12, and I would say at least 1 to 2 will finish within the 3-year.
Yeah, I think that's very good information, Debbie. We can have Julianne offer
Sure.
some comments as well, but I think if you're going to finish in 3 years, it's really important to come in with a very good focus because in your coursework, you will be writing papers. And so if you have a good sense of you don't have to be absolutely precise, but if you're very close to your research topic and your interest, all of these papers can be written in these courses that you're taking, and you can build on them. So again, that's where it's just sort of being efficient and being focused. I also think, if you are able to, you can go into year 4 and you can build on your experience. Hopefully you can get a research nurse or a graduate student research position. So again, it just sort of depends on the student. But Julianne, you might, and Kelly as well, sort of be able to give some comments there.
Yeah, I think it is doable. It does take a lot of coordination and discipline, and communication with your advisor. So you want to keep a good relationship with your advisor, have regular meetings, and be on track, just focused. I did, like I said, come in with a quantitative plan and switched to a qualitative, but I was still able to use the papers that I wrote in each of the foundational courses, not really to cut and paste into anything, but just to build on and to have that knowledge.
Yeah, I think coming in with a good research focus just helps you kind of go through the program more efficiently. Like Dr. Pelter was saying, for the assignments you're going to do for different courses, it just helps you like just kind of get a stronger grasp of that research interest during that first year, and then just kind of like what Juliana was saying, just provides you a good base for building in the next coming years. And I feel like the 3 or 4 year timeline is really also just dependent on like other things you have going on in your life, and kind of how much you can devote to the PhD program. So
Thank you, Kelly, and thank you, Julianne. That is the end of our session today. Dr. Lynch, did you have any final words before we close out tonight?
I would just say, maybe I'm overly biased, but we have an awesome school. And the faculty that are teaching in the PhD program are some of the top investigators in the country. They get grants and work well with students. And if you can give yourself the chance to believe you can do it, this is the place where you need to be. So give us some thought, ask more questions for sure. And hopefully we'll see many of you in the future.
Thank you so much, Dr. Lynch. I want to say a big thank you to Dr. Pelter, Debbie Akoba, Kelly Redmond, Julian Ballard, and Dr. Lynch for being here. We appreciate your time. And I also want to say a big thank you to you all for registering for our session today. We will have another one in October. If you haven't started an application, don't wait. Start it tonight. We have our emails in the chat. Reach out to us and have a good evening. Bye, everyone.